doctors were all left to go address thousands of people who work under him. He talked about 7,000 deployments that have been made under President Trump's command to have men and women in uniform going on the front lines to help at the state and local level. We've seen so much work being done in this plan, and I keep going back to it because I know some people want to deny that this plan exists. Of course, at the same time that they're criticizing components of the plan. Part of this plan, again, there's thousands more pages online. This is just a small part of President Trump's plan to combat the coronavirus. Part of the plan included stopping flights to China, which is Dr. Fauci testified under oath, saved lives. That was President Trump's call. He got criticized from it. In fact, he got criticized from some of the very people who say that he doesn't have a plan, yet they criticize parts of his plan, and that plan worked and saved lives. I know, Dr. Fauci, you testified under oath about some of the other decisions that were made by President Trump, working in conjunction with you and the rest of the team, these internationally respected medical doctors that saved lives. Thank God President Trump keeps his focus on carrying out this plan every day while people are literally trying to disagree with it and then deny it exists at the same time. And so when you look at now where we are with Operation Warp Speed, and this is something that is so incredibly important, working to find an actual vaccine for the disease. And again, Dr. Fauci, I know Dr. Redfield, you talked about this, but I appreciate you giving out the website. Again, over 250,000 Americans have now signed up to be tested for this virus. Might be one of the most tested trials for a new virus in American history. Probably the quickest time that we've been able to get a vaccine for a disease we knew nothing about even 6 months ago, because China lied to us, because China still to this day is trying to interfere with our ability. While we're working feverishly to get the vaccine, China's working feverishly to try to steal the vaccine. We ought to have a hearing on that, Mr. Chairman. I know Ms. Walorski talked about that and brought that issue up. When you look at the incredible work as Dr. Gerard's doing on testing, to get those testing kits into nursing homes, that's part of President Trump's plan, and in fact, it is saving lives. If those 5 governors who did not follow the federal guidelines would have followed the federal guidelines, again, as testimony under oath confirmed, thousands of deaths would not have happened. I wish they would have followed the guidelines. I wish they'd share the data. They're still hiding the data, those 5 governors. We've asked them. Those of us on the Republican side, if just one member on the Democrat side, Mr. Chairman, would join us in asking those governors to share the data that they're hiding from the American people, they're hiding from the families, the sons, the daughters, the grandchildren of those who died in those nursing homes. They're hiding that data, and they won't give it to us. They said they don't have to give it to us because not a majority of this committee has asked. I wish, Mr. Chairman, you'd join us in asking to get that data. What's wrong with asking for the facts? And so then you look at opening schools. You want to talk about saving lives, and this is one of those untold stories, unfortunately. There are 50 million plus children across America who are counting on us to get it right. The good news is the Trump administration has laid out a plan for how to reopen schools safely. Just right here, you talk about school administrators on the use of cloth face coverings. CDC suggests that all school reopening plans address adhering to behaviors that prevent the spread of COVID-19. They go into detail on all the things you should do, as we talked about, washing hands, all of that. You can socially distance, you need to socially distance. You can do it, in fact, you need to do it, but to say you can't do it is a cop-out. This is America, for goodness sake. We put a man on the moon. You can follow basic guidelines. If you don't want to trust CDC, go to the American Academy of Pediatrics, for goodness sake, who put out really good guidelines for how to safely reopen schools. And they went further and said the danger to children. You're hurting kids by not reopening schools. As Dr. Redfield testified, the thousands of kids that aren't getting diagnosed with things like child abuse, which is happening, unfortunately, it gets discovered in the schools. That's not happening. The nutrition programs, the mental health programs, there are drug overdoses happening today that wouldn't be happening if those kids were going back to school. You have to get it done, and don't say it's because of money. You can't say it's because of money. Every state in the nation's got money. We put over $150 billion out there. Do you know that based on this list, about $100 billion of money we in Congress appropriated, President Trump signed into law, about $100 billion still available in every state, and this money, without changing law, can be used to provide all of those supplies that the experts said you need to reopen your school safely. It's all there for you. If you run out, give us a call, but the money is there. Don't use that as an excuse. We all owe it to the kids. If there's never been a better time to make the argument for school choice, for goodness sake, you've got some of these unions that are saying they don't want to go back to school. Now, as Mr. Jordan pointed out, they're encouraging people to go to a protest where you're not socially distanced, but they say you shouldn't be able to safely reopen the school, but they want to take the money. How about if there's another school system that's willing to safely educate your child? Shouldn't the parent be able to do that? Why deny parents in low-income communities the ability to have the same choice that other people that aren't in low-income communities have? That ought to be on the table too, because there are systems all across this nation that have figured it out. Again, you don't need to reinvent the wheel. It's all there in the president's plan. President Trump has laid this out. You can go to the websites to get it. Come call me, I'll give it to you. But it's there. If you don't like it, you put a better plan on the table. Of course, they haven't done that. But in the meantime, don't deny those children the opportunity to seek the American dream that everybody else has deserved over the history of our country. And that's what will happen if they don't follow those safety guidelines and safely reopen the schools. So with that, Mr. Chairman, I again thank the witnesses, appreciate the work you're doing. Wish we could follow up on some of the other issues like Mr. Jordan, police officers that are being attacked right now and being put at risk to coronavirus. We had a hearing in this committee on our frontline healthcare workers, and it was an important hearing. I'd like to see us have a hearing on those law enforcement officers who were being put at risk. Actually did develop an early plan called 15 Days to Stop the Spread. It was one of the first real organized plans to encourage states to pull back. It wasn't an easy plan for the president to have to issue, but it was necessary. And in fact, there were meetings in the White House. I think Dr. Fauci and Dr. Birx were there as that plan was being carried out, that you determined maybe we need to go longer, to go 30 more days. And in fact, by going 30 more days, you could save 1 million, maybe 2 million more lives. And then President Trump announced that plan and did save those lives. The Trump administration then released a plan called Guidelines, opening up America again, on how states could safely reopen. It's this part of the plan, by the way. Maybe some people are so busy reading tweets that they haven't actually read the plan. It's really good guidance issued by some of the most recognized international experts on disease prevention. Some of you here today represent parts of this plan. And so in opening up America, again, showed how states could safely reopen. The plan was developed by public health experts. Some complained that President Trump didn't have the power to force states to reopen. So the administration actually released guidelines so that states had discretion. Each state, we all understand how the 10th Amendment works. Each governor is in charge of their state. Nursing homes are actually regulated by the states, not by the federal government, but we give guidance. And it's been really good guidance. And in fact, that guidance has saved lives. We hear cities, and we hear people talking about the cries of the need for testing. So let's talk about what HHS has done to lead on testing. Zero tests. Again, go back a few months ago, zero tests to now over 800,000 tests a day. In a matter of just months, over 52 million tests have been conducted nationally. And again, nobody's slowing down. We're actually increasing that number. We will be over 1 million tests a day. Maybe we'll have a hearing on how much progress we've made there, and we want to continue to make progress. I know Dr. Gerard was in Baton Rouge with me just a few weeks ago with the Vice President talking about what we're doing to increase testing, even to limit the number of days as a goal to get below 7 days for anybody to get results. And that number has narrowed dramatically. Now more than half of Americans who get tested get their results in less than 24 hours because of the rapid work that this team has done carrying out the president's plan. Testing is not just about numbers, it's about targeting testing to the right people at the right time. To that point, the Trump administration's begun distribution of rapid point-of-care tests to nursing homes. I've talked to nursing home heads recently who said that decision by the Trump administration to purchase an actual testing kit for every single nursing home in America, over 15,000 nursing homes, each of them will have their own 15-minute test. That will save lives. That's part of this plan. On May 15, 2020, President Trump announced Operation Warp Speed. Again, part of a very directed national plan to combat this deadly virus. Operation Warp Speed is a public-private partnership between several federal agencies to accelerate the development, manufacturing, and distribution of a COVID-19 vaccine, as well as therapies, diagnostics, other things to to direct the specific goal of delivering 300 million doses of a safe, effective, FDA-proven vaccine for COVID-19 by January 2021, and we're seeing that happen at remarkable speed. In fact, we're not just going to wait for FDA approval, they're mass producing those vials right now, so that if there is one of those vaccines approved by the FDA, it's ready to go. We don't start manufacturing at that point and cost us more weeks. We're actually ready to go. By the way, that's some of that money was money that we passed in the CARES Act that President Trump has used effectively to be ready as the vaccines are being developed in testing phases. Dr. Fauci, I look forward to learning more about the stunning progress that we've seen researchers make on cures and vaccines. I know you've been involved in researching some of the most awful, deadly viruses that we've known in the history of the world. HIV, Ebola, of course now Corona. We still don't have a vaccine for HIV. There's been over 10 years of work, and you've done remarkable work to at least give therapy so that people can extend their lives, but not a proven vaccine for so many of these diseases years and years later. And here we are 6 months into Corona, and we are this close to a vaccine. So you look at where we've seen the Chinese government. We hopefully will get into conversations about how costly it was, how many lives were lost because the Chinese Communist Party lied to the world, not just the United States, but the world, getting the World Health Organization to give false information in those critical early days. But why don't we now talk about moving into August? A lot of work is being done to talk about how to safely reopen schools. In fact, more guidance was just given as part of this plan by CDC to safely reopen schools. We saw, of course, the American Academy of Pediatrics gave great guidance on how to safely reopen school, and that every state for sanitizers that are helping work with President Trump to develop this plan. Is that correct? If I could ask any of y'all, is that correct? By the way, were any of you sidelined from coming here? I know some people try to use that term. I haven't heard of anybody sidelined, but if any of you were sidelined, please share it, because I haven't seen that. Good to see all of you here. Dr. Fauci, let me ask you about some of the decisions that you worked with President Trump on, and the whole team did. I know when you go back to the beginning of this, the China ban was very heavily discussed. Were you involved in working with President Trump on deciding to ban flights from China?
Yes, I was.
Do you agree with that decision?
I do.
Do you think that decision saved lives, Dr. Fauci?
Yes, I do.
Do you agree with the decision when ultimately we saw spread in Europe, and then the president recommended that we extend that to Europe? Did you participate in that discussion?
I was actively involved in that discussion, sir.
Do you agree with that decision?
Yes, I do.
Do you think that decision saved lives?
Yes, I do.
Eventually, then, we saw the United Kingdom have an outbreak, and there had to be a tough decision made. Do we extend that to the United Kingdom? Were you part of that decision?
I was.
And do you agree with that decision as well?
I do.
Did that decision save lives?
Yes, it did.
When you look at the 15 days to slow the spread, initially it started at 15. Were you part of the decision to implement that decision?
I was very much involved in that.
Did that decision save lives, Dr.
I
Fauci?
believe it did.
Then when President Trump met with you and Dr. Birx to extend that another 30 days, do you agree with that decision that President Trump made to extend that?
Yes, I was very much involved, and I agree with it.
Did that decision save lives, Dr. Fauci?
I believe it did.
So I know we've heard a lot about disagreements. Clearly, there are many decisions made. In fact, there are many very internationally respected doctors that are involved in each of those decisions. Is that correct?
Yes.
By and large, would you say that you and President Trump have been in agreement on most of those decisions?
We were in agreement on virtually all of those.
I appreciate that.